Good afternoon. I'm going to start off by telling you I'm coming from three perspectives which are a little different than those of others. First, I had the opportunity over the last 10 days or so to facilitate 3 roundtables with law enforcement personnel. Second, I'm a former police officer. Spent 17 years with the Howard County, Maryland Police Department. My time on the street, I was involved, unfortunately, in 3 shooting incidents. So I have firsthand experience. Third, and probably most importantly, I had dinner with my brothers. One of my brothers is retiring as head of Child and Family Services for the Archdiocese of Baltimore, and my other brother, I have 4, but my other brother who's in the field, is an ace homicide investigator. Little monkey has really excelled in that field with the Baltimore County Police Department. When I told my 2 brothers who were in the field that I was coming here, both of them jumped in immediately and said, here's what you need to tell them about research and what we need. My purpose underlying the conversation, truly, is to bring together the field of public safety and public health. We do for each other or to each other, but not always with each other. And we can advance research when we blend the 2 professions at a much higher level. Secondly, I've been asked by folks in the 3 roundtables and my 1 brother who's in homicide to share with you what really goes on in a gun encounter. And third, to present research topics for your consideration. I'd like first to talk about some research challenges that we have to overcome in order to advance the evidence and to make a difference. One, as many of you know, is we have turnover in law enforcement at a very rapid rate in a very fragmented profession. Every time we seem to advance the research agenda in a police agency, the chief of police changes or members of the command staff change, and for every step we take forward sometimes, we take 2 steps backward, hoping that the next person who fulfills that rank has the right personality, the right dedication to advance the research. The issue in law enforcement is that we have no succession plan. The commander, the chief of police you're working with, is not necessarily going to be replaced by the person that he or she is developing to take that position, because that's not the way our promotional process works. In fact, in some departments, you get promoted to senior command, and you will move by policy to another unit. So we're always trying to develop a research focus in police departments, and it is hard. Another challenge that we have to overcome is that law enforcement agencies focus on the mass needs of the communities they serve. That will always be first and foremost response to calls for service, particularly 911 emergency calls, response to community needs, prevention, traffic safety, those things. Rarely will the highest priority of the police department be the nation's law enforcement research agenda. The research agenda, with great respect, it's an important agenda, tends to follow the money. The money tends to follow the headline of the day and political response to that headline of the day. By coming together, we can overcome some of these challenges. Law enforcement wants to be better informed. The problem is, in part, that the language of research is not the language of law enforcement. One of the things we'd like to see underlying the research agenda is that all researchers become fluent in 3 languages: internal, external, and political. And we can make great strides forward if we master those 3 languages. Internal, meaning researchers talking to the research community. External, meaning researchers talking to law enforcement and practitioners. And then political, talking to funders, legislators, and others. 3 distinct languages that have to be used properly when speaking to specific audiences. It's also important to distinguish gun violence by type. And law enforcement officers say that the way researchers type gun violence isn't the way that they type gun violence. I'll come back to that in a moment. The concern is that we tend to type different types of gun violence together. That's not how law enforcement looks at it. Law enforcement officers, and talking to investigators, if they're patrol, investigators talking to prosecutors, talk about 10 different kinds, well, really 9, of gun violence. And we throw military in just because it's a legitimate type of use of weaponry to kill others, but that's not what we get involved in law enforcement, as you know. And I won't go over them all. They're here for you, and they're there. But we do distinguish the types of violence, gun-related violence, a little differently than the research community. We get a little more specific, and it would help the research agenda if it was addressed, focused better on the needs of the law enforcement community and the way they refer to it. Forgive me, this isn't advancing. There we go. The underlying factors that law enforcement officers talk about in regard to why people use guns, these categories. Again, war we put in because we talk about the military, but that's irrelevant to this conversation. Not irrelevant, but not a priority. Greed, anger, vengeance, fear, which we don't have a lot of conversation about. We look at fear. A couple of us were talking about it earlier. We think fear drives a lot of gun violence. It also prevents a lot of gun violence. People who have guns, we don't know much about this. People who have guns choose not to use them in a home invasion. The gun's sitting right there. But they'll stay on the phone with 911, they'll go get a baseball bat, they'll turn on lights, they'll go get their dog, but they won't turn to the gun that they have in the house for protection. Despondency, survival, protection, and that includes executive protection. That's a law enforcement use of weaponry. Prevention, carelessness, illness, that includes mental illness, a lot of things that were discussed earlier, and of course war. A gun incident. We think it's very important in law enforcement. We think it's very important for the research community to really understand what goes on in a gun incident. Not necessarily a mass casualty event. That is a very distinct type of incident. It is an aberration compared to what law enforcement deals with every day. And the research, we think, should focus on what we deal with every day, not the aberration. A gun incident is very quick. Lasts about 2.5 seconds, start to finish. From the point you make the decision to fire to the point that it's over, about 2.5 seconds. It's very close, usually within about 6 feet, despite what you see on TV and what some of us grew up with, the cowboy shooting on a horse from horseback at 50 yards and hitting his target. Doesn't work like that. It's chaotic, it's constant motion, and that affects some of the training that people are getting in how to use firearms because they get training in an environment in which they're shooting at still or moving forward targets. It's not the kind of motion that exists in real life. The shooter, we know, has the familiarity with the weapon, but familiarity may have nothing to do with skill. We think research is needed in that area too. We know for a fact the shooters almost always had prior contact with the victim, particularly prior contact within 72 hours prior to the shooting. It involves a handgun rather than a long gun. In most cases, the shooter chooses the environment in which the incident occurs. The victim has little or no defense at the point of shooting, again, even if there is a gun available to the victim. Multiple rounds are fired except for suicide. And by the way, most rounds miss their target. And the important thing is, and there's a great area for research, the missed rounds go somewhere. They don't just disintegrate or disappear. We know that a police officer who is committed to using a gun, who wears it every day, who's trained in it, who takes an oath to protect life, everything you know, shoots accurately in a crisis about 27% of the time. And the vast majority are non-fatal. So for research purposes, here's some considerations. We'd like to look at fear. Again, this is from the law enforcement community. Fear is a predominant influence of the decision by non-criminals to use or not use firearms in a crisis situation. We know very little about the influence of fear. Fear drives people to do harm. Fear drives people to move away from harm. And it's always driving people to do something. We want to identify better than I've done for you today the needs of frontline law enforcement personnel regarding the research agenda by the public health community. We'd like to have more input to it, as opposed to having it done for us or to us. We'd like to see research on assumptions being made about the skill of people in using a handgun in a life death encounter, particularly those who have gone through the different training courses, from a traditional combat course to a simulated crisis course. And we've done some work in my division at Hopkins on those assumptions. And right now, because it is a hot topic, we would like to see research, and we've begun some of this already, on assumptions associated with teachers and school officials using guns in a violent encounter occurring in a school environment, particularly a classroom. Off the record, without having any concrete research findings, we think the idea of arming, meaning law enforcement, the idea of arming teachers is stone cold nuts. That's a technical term. But it's happening all over the country. There are other items. Those were the 4 priorities. There are other items that we'll put forward for your consideration. Having a gun at the ready versus your readiness to use a gun in the home. Focusing, this was talked earlier, we'd like to see research focused on the various types of law enforcement agencies. Urban, suburban, rural, large, small, and specialty units like transit and campus police. Each has its unique characteristics, its unique culture. One of the things we're very concerned about in all the rhetoric, all the talk about people having guns in the homes, what have you, particularly in schools and commercial facilities, is how are we in law enforcement supposed to identify the criminal shooter versus the non-criminal shooter in the moment of the crisis? And very few people are talking about that. That's a big concern for us in all the talk about active shooters in schools and workplaces. And finally, we'd like to see the public health community en masse learn about the culture of law enforcement and how law enforcement officers live and work to help advance the evidence. Thank you.
Thank you very much. I realized as Jay was starting that we didn't have any little green and yellow and red light thing going, but it's been perfect because you each have stuck precisely to 15 minutes. So we're going to take that as a challenge for our next 2 speakers, the first of whom is David Hemingway, who is a professor of health policy and management at the Harvard School of Public Health, where he is also director of the Injury Control Research Center. David.